Through the years, I've been an active person, not a big athlete, but I played high school football. And I've always been active in carrying cameras around, a backpack full of camera gear and a tripod. And then also just doing some construction. I did a lot of work on my own house. And as the years went by and I got a little older, my knees started giving me more and more pain, just my left knee. But it got to the point in which I would go for a short walk and my knee would just start to hurt and throb like crazy. Then it went from there to the point in which if I was on my feet for any period of time, it just hurt like crazy. And then after a while, it got to the point where it would just wake me up in the middle of the night. I didn't have to do anything. The knee just hurt. So finally, a series of x-rays, and I got myself over to the orthopedics department at the University of Iowa and got to meet Dr. Charles Clark. And we looked at the x-rays, and it was obvious that there's a point at which the cartilage is worn away, and at this point there's just bone rubbing against bone. So my source of pain and my source of discomfort comes from this region of the knee right here. And so he scheduled for me a knee replacement surgery that winds up looking like this. And it's a place where the knee is replaced with some pieces that have a new kind of plastic cartilage in between them and give me a relief from pain. One of the reasons people come to retire in Johnson County, Iowa, is to have access to the University of Iowa Hospital, and I'm just really lucky that it's there. I found myself really being under the care of people who were just as nice as they could be and very concerned about getting me through the night. I'm walking with a walker, pushing the walker. I'm being aided and supported by a nurse in an orthopedic clinic. And we're going to a nurse's station, which is about 50 feet down the hallway. And this was my first walk on my new knee. And this was the morning after my surgery. And it was sort of like, we can do this. I'm just going to keep moving forward and making it happen. For the first month, it was, I have to admit, very, very painful. And finally, at the end of a month, I got to the point in which the pain was starting to get a little less. I went from a walker to crutches to finally just walking around. And for me, down here in the studio, one of the biggest changes after a month, I could go up and down the stairs, and I could actually start to carry things around, and I could get my life back to work. I have an old car that I could get in and actually run the clutch and drive. People who know me and know what I've gone through ask me about recommendations for knee replacement surgery, and I would be sending them to the orthopedics clinic at the University of Iowa Hospital. Quality of care, the quality of the people, the concern for patients could not be better, and it would be a good recommendation. And after a year now, it's just, I don't even think, let me put it this way, one of the best things I can tell you, it's wonderful to get up and go through a day and never think about your left knee. I go through a whole entire day being active and working like crazy and never think about my left knee. And that's a good outcome, really good.